right, class, welcome everybody. And we're going to talk about a drug today that is not used that much on EMS, but quite frankly, it should be, but it never will, and I'll explain why that is. And that is Levalbuterol, otherwise known as Xopenex. And this is actually a good drug. The Xopenex, it actually does all the bronchodilation for us with minimal increase in cardiac rate. And so, yeah, wow, it helps. It helps patients with reversible obstructive airway disease. So, hey, great, this sounds wonderful. Well, why aren't we using it? Okay, and again, it affects the beta 2 adrenergic receptors, and it's very selective in the way that it does it. And so, it's a very good bronchodilator. Okay. Again, it facilitates mucus drainness and vital lung capacity. It's just a great drug. Well, again, why don't we use it? Okay, onset actions 2 to 15 minutes. Probably would know that. Again, it's just like an albuterol treatment, and the durations for roughly around 5 hours for a pediatric and 6 hours for an adult. Ooh, it's getting even better. You give one of these, and hey, they last pretty long time. So far, so good. So we use it for bronchial asthma, and again, reversible COPD when you have bronchospasm or emphysema-related bronchospasm. Great, wonderful. Again, the cool thing is this drug doesn't have the side effects that the albuterol does, okay? That's the biggest thing with it. And even the things that it does have, as you noticed, a lot of these particular medication side effects are very similar to what albuterol has. Levalbuterol, much tamer. Much tamer, okay? With that being said, again, relative tachycardias, you still want to be careful. If they're less than 6 years of age, we usually don't use it, and if it's a pregnancy patient, we usually do not use it. If they have any type of sensitivity, obviously, or they have sensitivity to racemic albuterol, we want to stay away from it as well. But so your interactions, again, very similar to your albuterol. And so, again, it has less side effects, but here's the kicker, though. Why don't we use it? And the reason that we don't use it is because a fish of albuterol costs about 50 cents. A fish of levalbuterol costs about $14. So it is strictly a cost thing, but you're going to see this drug on your COPD patients or your chronic patients in which their heart rates are known to get up, especially if they've got a problem with tachycardia. They're going to give them the levalbuterol instead of giving them the regular albuterol fish, okay? Now, again, it's usually, these are the preparations. 1.25 is kind of the common one that I've seen, and that's because you usually give that dose as 1.25 is the standard dose. But 0.63 to 1.25 is your normal dose of every 6 to 8 hours. And then for your pediatric doses, it's usually cut in half. If you can remember that, you're pretty safe. And patients over 12 years of age, we kind of consider them adults, so you can give them the 1.25 of those for severe asthma attacks that have not responded to the 0.63. All right, we give it by nebulizer and nebulizer only. We don't pour it down the tube. We don't do anything like that. And then, again, it's usually pretty safe for the pregnancy, but again, remember that is if they are pregnant, we kind of want to stay away from it. It can cause some serious side effects. It does cross the placental barrier, so we got to be careful with that. All right, that is it for albuterol. Again, if you got your choice, the doc says, would you like albuterol or levalbuterol? Say levalbuterol. Granted, you're going to pay a little bit more for it, but it works better. All right, guys, see you on the next one.